In this presentation, we are going to introduce the most important aspects of occupational health history at international level. So, let's begin.
Egypt 3500 before Christ. A special law dictated by the pharaoh for warriors, embalmers, and weapons manufacturers to carry out their work and prevent occupational accidents. Mesopotamia 2000 before Christ. The Hammurabi Code was created that contemplated aspects of social security. They were engraved on a stone so that the Babylonians knew their rights and duties.
Hippocrates, 416 BC, considered the father of medicine. He described intoxication as an occupational disease. Middle Age 476 and 1453 AD. At this time, states were formed and responsibility to protect citizens fell of them, a circumstance that later founded the Bureau of Public Health and they received professional training in that area.
Technological processes are improved, appearing new branches of industry and new types of polluting factors that affect the health of workers. Work is in the next field because the industrial revolution is coming. The driving force in the industry appears and the weight in the revolution of work accidents and disease.
In 1908, in England, there appeared some studies about occupational medicine, so they have more scientific basis to talk about occupational health. Then, Thomas Oliver published a book called Diseases of Occupation. Then, in 1919, in the United States of America, appeared the first school with recognition in industrial hygiene.
In 1946, the OET International Workers Organization was created, but employed and workers themselves and obligated to collaborate with companies in the deployment and application of occupational rights prevention.
In this presentation, we are going to introduce the most important aspects of occupational health history in Colombia. So, let's begin. We begin in February 15 in 1819. So, the first antecedent in Social Security that we find is with Simon Bolivar, when in his speech in front of Angostura Congress he said, "The most perfect government system is that which produces more happiness, more social security, and more political stability." Then we jump to the 20th century because the concepts associated to worker protection of danger and occupational risk were aspects unknown in Colombia until the beginning of 20th century. So let's see what happened then.
Year 1904. Rafael Uribe, he was the first to propose a conference and made a workers' health in the Municipal Theater of Bogota. Year 1910. Rafael Uribe, year he asked for compensation for workers who were victims of work accidents. Year 1915. Rafael Uribe specifically addresses the use of safety at work in what later became Law 57 of 1915, known as the Uribe Law on the Occupational Accidents and Occupational Disease, which became the first law related to the use of occupational health in the country.
Year 1935. Labor legislation is established where the rights of work are discussed. On the 3rd of July of 1936, the law began to govern. Year 1938. Through Law 53, the right to protection was granted to the pregnant woman, giving her the right to take weeks of paid leave at the time of delivery.
The substantive labor code is used with which multiple standards related to occupational health were established, such as working hours, compulsory rates, compulsory benefits, among others. The Labor Minister formed the Occupational Health Division, which was in charge of the prevention and control occupational accidents and diseases. Decree 3170 approves the mandatory social insurance regulations for work accidents and occupational disease.
In 1983, through Decree 586, the National Occupational Health Committee is decreed as a result of initiative and participation of the National Occupational Health Committee. Decree 6040 of 1984 is inside, which establishes two bases for the administration of occupational health in the country. In 1984, the first national plans